if you were to redo all of your training again in the current era, what would you do?
Okay, that's interesting question, and I think very topical. And before I give you the specifics of what I would do, I will tell you that what I will do will be conditioned by the trends in healthcare that we're seeing. And so what we're seeing is that we're evolving from silo to an integrated approach to care. So we're going from deciding on what an imaging modality can do for a patient to a new paradigm where we take the patient and we decide what is the best approach for that patient for that question. And so we're evolving now into patient-centered care, and patient-centered care will require will require specialists. And so imaging is now becoming a multidisciplinary specialty where in order for you to serve as an effective consultant, you're going to have to know more than just the pedestrian knowledge about an imaging technology. And so in order for you to be an effective consultant, you're going to have to know strengths and weaknesses of the different approaches for the different questions that you might be asked to consult about. And therefore, if I had to do my training again, I would say, well, doing echo alone or doing nuclear alone or doing CT is just not going to be enough. So I do believe that the training needs to be comprehensive. By nature of being comprehensive, it's going to be extensive. So unfortunately, what this will do to you is that you will have to invest more time so that having done 3 years of cardiology is not going to be enough. And so you're going to have to invest some additional time. I do believe that you need to pick one area where you want to be really, really good. And that will be the core of your activity in imaging. However, you cannot be narrow-minded. You need to learn more than just the superficial understanding about MRI, about CT, and about nuclear cardiology, because the test that you do may not always be the best test for that patient. So I think if I had to redo it all over again, I would look for opportunities of training where I could get that exposure to patient-centered care while taking deep dives in imaging. You know, you really need to understand the nitty-gritty of what you do, but keeping the big picture in mind, that the big picture is not just to learn about one modality, it's about how am I going to eventually find a job in this healthcare market. And I think more hospitals will require that you do more than one thing. And so if you're an echocardiography, it's great. What else can you do for us? You know, so I think that will require that evolution of training. And I think I encourage trainees to really abandon this silo approach to training. You really need to understand imaging in general, because before an imager, you are a clinician. And so you need to really understand the strengths and weaknesses of that to be able to really be an effective clinician and imager.
That's great. So really a multimodality approach. Patient comes first, clinical mindset,
Absolutely.
And then integrating that into the practice.
Absolutely.
That's fantastic. Any other last-minute advice for people who are interested in fellows who are interested in going into imaging?
Well, I think you have two approaches for training. One is you want only clinical training, or you are sort of an academic mindset that says, look, I'm not interested in going into practice. I really want to prepare myself for an academic career, which means I'm going to write grants, I'm going to apply for funding, I want to publish. Well, that may be a different, you may have a different requirement for that kind of training. And so you may need to look into training investments of time that will have a balance between how much clinical and how much research time you have. And then for those who really want to prepare themselves for practice, well, it's going to be pure clinical training with some time in research, but it's mostly clinical.